Hello and welcome. Today we're diving deep into a rare kidney disorder called dense deposit disease, also known as membranoproliferative glomerulonephritis type I or MPN2. This disease, though uncommon, can have a significant impact on kidney function. So, let's unravel the complexities of dense deposit disease together. The exact cause of dense deposit disease remains somewhat of a mystery, but it's primarily considered an autoimmune disorder. This means the body's immune system mistakenly attacks its own healthy tissues, in this case, the kidneys. A key player is a protein called C3, a component of the complement system, a vital part of the immune system responsible for fighting off infections. In individuals with dense deposit disease, there's often an abnormal activation of the complement system due to an autoantibody called C3 nephritic factor, or C3nef. This autoantibody stabilizes the C3 convertase enzyme, leading to its overactivity and the deposition of C3 fragments in the kidneys. Now, let's explore the pathophysiology, or how the disease develops. The excessive activation of the complement system and the presence of C3nef leads to a continuous and uncontrolled production of C3 fragments. These fragments are deposited within the glomeruli, the filtering units of the kidneys, specifically within the glomerular basement membrane. These dense deposits disrupt the normal structure and function of the glomeruli. The glomerular basement membrane, normally a thin, delicate structure, becomes abnormally thickened and dense, hence the name dense deposit disease. This abnormal deposition triggers inflammation and damage within the glomeruli, ultimately impairing the kidney's ability to filter waste products from the blood. Dense deposit disease is a rare condition. Its exact prevalence is difficult to determine, but it's estimated to affect around 1 to 2 people per million. It can occur at any age, but it's most commonly diagnosed in children and young adults. There's no known specific racial or ethnic predisposition. Because of its rarity, accurate epidemiological data is challenging to gather. The signs and symptoms of dense deposit disease can vary from person to person. Many individuals initially experience subtle symptoms, which can make early diagnosis challenging. Some common signs and symptoms include a proteinuria, which is the presence of protein in the urine, hematuria, or blood in the urine, which may cause the urine to appear pink or brown, edema, or swelling, particularly in the ankles, feet, and around the eyes, high blood pressure, and fatigue. As the disease progresses, individuals may experience more severe symptoms related to kidney failure, such as decreased urine output, nausea, vomiting, and shortness of breath. Diagnosing dense deposit disease requires a comprehensive evaluation. A kidney biopsy is essential for confirmation. During a kidney biopsy, a small sample of kidney tissue is extracted and examined under a microscope. In dense deposit disease, the biopsy will reveal the characteristic dense deposits within the glomerular basement membrane. In addition to a kidney biopsy, other diagnostic tests may include urinalysis to detect protein and blood in the urine, blood tests to assess kidney function and complement levels, and genetic testing may be considered, as certain genetic mutations have been associated with the condition. Dense deposit disease is not currently classified into distinct subtypes. The primary characteristic is the presence of the dense deposits in the glomerular basement membrane. However, researchers are actively investigating potential variations in disease presentation and underlying mechanisms to better understand the heterogeneity of the condition. Unfortunately, there is no cure for dense deposit disease, and treatment focuses on managing symptoms, slowing disease progression, and preventing complications. The treatment plan is individualized based on the severity of the disease and the individual's overall health. Common treatment strategies include medications to control high blood pressure, immunosuppressants, such as corticosteroids or mycophenolate mofetil, to suppress the immune system's activity and reduce inflammation, plasma exchange, to remove abnormal antibodies and complement components from the blood, and dialysis or kidney transplantation may be necessary in cases of advanced kidney failure. Currently, there's no known way to prevent dense deposit disease, given its autoimmune nature and unclear etiology. Early diagnosis and prompt management are crucial to slow disease progression and minimize kidney damage. If you or someone you know experiences any of the symptoms we've discussed, it's important to seek medical attention promptly. The prognosis for individuals with dense deposit disease can vary. Some individuals may experience a slow and gradual decline in kidney function, while others may progress to kidney failure more rapidly. A significant proportion of patients eventually require dialysis or kidney transplantation. Recent research is focused on understanding the underlying genetic and immunological mechanisms of the disease, as well as developing targeted therapies that can specifically address the abnormal complement activation. New complement inhibitors are being investigated in clinical trials, offering hope for improved outcomes in the future. Additionally, research is exploring the potential of personalized medicine approaches, tailoring treatment based on an individual's specific genetic and immunological profile.